Mark. I'm one of the physios working at Institut Guttmann, work in rehab and research. Particularly spinal cord injury can be difficult at times. One of the main things can be the availability of equipment. Often as well, it can be quite hard work for the physios. Yeah, it depends. I mean, sort of more traditional methods have been put in the long leg splints, so the CAFOs on. So if someone's got enough trunk stability, we put the CAFOs on and the walking frame, and maybe with one or two of us, we're actually helping that patient take steps and move forwards, but it can be quite hard work. It's definitely helpful for the physios. Patients in particular very much enjoy it. You can actually get what we say more normal step patterns, for example, with the hip and the knee. Often patients can fatigue quite quickly with the other methods. With the robotics, we find that actually you can get a lot more repetitions, which is very important, as we know, for anyone who has any potential to recover gait after a spinal cord injury. High repetitions is one of the main things that they need to be doing. On one side, you've got those patients who are sort of more incomplete spinal cord injuries. So in that sense, a robotic exoskeleton can help us a lot in terms of getting lots of repetition of gait training, helping to strengthen the muscles, helping the patient to get used to taking steps and getting that rhythm of walking. So we've seen some change with a couple of the patients. Your other side are patients who are more chronic and often the complete spinal cord injuries. With these patients, we wouldn't necessarily be using it in the idea that they're going to recover walking outside of, without using the robotic. But by using the robotic, we can see things like reductions in spasticity. We can help with circulation and bladder and bowel. Bone health is obviously really important. So the exoskeleton can really help in terms of achieving lots of things at one time. And also, I think as well for the patients to feel good. Yeah, I think we had a good experience, and we had lots of different types of patients. To our last patient, who was actually doing very well, he was progressing very quickly, but he was a lower level injury. He was improving. With the exoskeleton, he actually improved more and more and more. But then with our other guys, the sort of more severe injuries, I think the great thing about the ABLE is you've got that adaptability. We can change the amount of assistance in the motors, for example, and that can help a lot in terms of adapting how much support the patient is and isn't getting. My biggest learning probably would be to trust the patients a bit more with how much stability they had. So I think just purely from my own mentality, I was holding on and giving them more support than they needed. I think sometimes I was even pulling them back slightly. So yeah, that's one thing. I think certainly the amount of support that the exoskeleton gives and the patient is actually. I like a few things actually. It's very quick to understand. It doesn't take long. I think it takes no more than a session or two to really get a handle on. But I think it's at a good level where there's things that can be changed, like parameters, length of step, etc., that can be changed, but it's not too much, it's not too overwhelming for someone who's like me, not so technical. The speed at which you can get it on and off, it is light as well, and the turning assistance. I like the turning assistance. That's a good feature. Lots of them reported how stable they felt. She felt that they could do lots more repetition. So some of them were already doing locomat training, some of them were already doing the CAFO training. They were saying, I can maybe do 10-15 minutes. With the other one, with the EXO, I can do half an hour. So I think that ability to go further, do more. The more chronic ones, we saw a reduction in spasticity. One of our guys, like I say, went from quite heavily assisted walking with a frame to then using crutches. So by the end of the training, he was using crutches with just distant supervision. What would be great to see is the ability to then, how we do side steps and backward steps. You need to have that adaptability in the environment, so being able to go in, whatever you want to call it, 360 degrees, if that makes sense, directionally. So chronic spinal cord injuries, they do need stand-in programs. So they should be stand-in, if not every day, at least 3 times a week. If you had an exoskeleton that could do that and do cardiovascular training, then definitely. Outside in the community, I think that step is something that would be amazing. You know, someone can put the exoskeleton on, up, and then they're out, you know, out for a couple of hours walking or whatever with friends and family. If it could get to that point, that would be incredible, I think. If we're thinking about an exoskeleton that can be used in the community and beyond, we need to be thinking about where do patients get to in 5 years, 10 years, etc. What's their daily life look like? To actually produce an exoskeleton that provides more benefit, more quality of life for them. Simple, light and efficient.